What do the aftermath of a disastrous South American nightclub fire, an island nation off the west coast of Africa, and the world's largest healthcare system have in common? Connected health and GlobalMed. Early in the morning of January 27, 2013, fire broke out in a nightclub in Santa Maria, Brazil, with as many as 2,000 people inside, most of them college students. Fireworks ignited by band members started the fire. 242 people died trying to escape. Another 100 were injured, and they overwhelmed the local hospital. In Sao Paulo, the Albert Einstein Hospital answered the call for help. It flew a carry-on-sized case, GlobalMed's transportable exam station, to Santa Maria that would allow the physicians treating survivors to consult with specialists.
I started to work with telemedicine a few months before the nightclub fire in Santa Maria. When I became aware of what had just taken place, I made myself available to assist in the case. The fire happened on Saturday, and Monday morning I was already in Santa Maria.
We provided support to the local university hospital in Santa Maria, leaving the doctor round the clock with the GlobalMed telemedicine system available to connect to many medical professionals and specialists. What we really do in telemedicine is to transfer knowledge via technology.
We were able to connect Santa Maria directly to Albert Einstein Hospital and various places around the world. United States, Iraq, Japan, various specialists that had prior experience in handling similar cases with fire, and specifically fire in nightclubs. The KISS nightclub ceiling was covered with a thick foam that released a toxic, cyanide-filled smoke that many of the young crowd present inhaled this smoke. The precise treatment was only possible via the use of telemedicine.
And they used this small camera, GlobalMed's Total Exam 2, to acquire digital images of victim skin so that Sao Paulo could send graphs that matched skin tones to Santa Maria. Nearly 3,700 miles away in the Atlantic Ocean, the nation of Cape Verde is home to 500,000 people who live on 9 of the 10 islands. Travel to the 2 large hospitals on the main island of Santiago is expensive and limited to 1 or 2 flights and ferry rides each day. Faced with the inconvenience and cost of transportation, residents delayed going to the main hospitals until health problems became serious. At the request of the government, the International Virtual E-Hospital Foundation designed and implemented a telemedicine program for Cape Verde. And now, GlobalMed First Exam mobile telemedicine stations are in place on each of the outlying islands, where residents can see a physician on Santiago without actually going there.
What this means is that if the doctors on the island of Brava have a more complicated situation, they can consult their specialist colleagues at the hospitals on the main island of Santiago and be more at ease because of it.
In one case, a pregnant woman was able to see her baby for the first time during an ultrasound exam. Another patient learned that he had a tooth abscess when a dentist on Santiago conducted a remote oral exam. These technologies are breaking down geographic and socioeconomic barriers. In Latin America, American doctors and medical students are able to see and treat patients and confer with colleagues in the United States on difficult cases. Dr. Mark Stavros takes a group of his Florida State medical students to rural areas of Panama. Patients come from great distances and begin lining up every morning. For some, this is the first time they have ever encountered a doctor. With a GlobalMed transportable exam station, the group was able to see patients and get input instantly from physicians back home. Many companies are looking for ways to provide health care to their employees, especially in remote locations. Petrobras is a large oil and gas company based in Brazil. It pumps crude from below the Atlantic Ocean to more than 100 oil platforms. Employees spend weeks on those oil rigs. When they are injured or become ill, they can go to the platform clinic for very basic care. Should the problem be more serious, though, someone must make a decision: fly the worker to the mainland or let him stay. The flight can cost tens of thousands of dollars. Using GlobalMed solutions on Petrobras oil platforms, A physician on shore can examine the patient and make the call for an emergency helicopter. Access to quality health care is a global challenge, one that GlobalMed is meeting every day.